Hello, everyone. Just give me a few minutes to set up. I'm actually on COVID duty right now. So give me maybe 2 or 3 minutes. I'll set this up and we'll start, okay? Sorry for the delay.
Sure.
Hello, everyone. How's everyone doing? Um, so what you're seeing behind me is actually the NSCI Dome in Mumbai, where a lot of concerts and stuff happens. So I'm working here today and I'm going to be conducting this workshop. So bear with me if you face any network issues or if you face any problems of the sort, because I am on a mobile 4G network, right?
Sure,
So let's start
not an
today. Let's start today with a recap, as I promised, of yesterday's session. So yesterday we spoke about how you're going to handle your data in brief, and then we went on to speak about journals, their impact factors, their DOIs, and whatnot. So I'm just going to make a few concepts clear that some people, because yesterday we were sort of in a rush. Dr. Parag also had to rush through his presentation. So we're just going to make a few things clear before we move on to our subject for today, which is continuing with data management and research, as well as how to write a paper, the different sections of an original article and stuff, right? So yesterday we spoke about the different kinds of population, the total population, the target population, and the study population, how you have to define a target population and then pick and sample different people from that target population so that you can say that your study applies to this set population, whether it's people above 50, whether it's people below 20, etc. Like we discussed yesterday, it also not only helps you to be clear in your mind that I'm going to include these people in my study so that you're clear right from the get-go, but it also helps other researchers know that when they read your paper, whether or not they need to apply your results to their patient population, right? So if your results are related to someone in the pediatric age group, then a person who's treating geriatric patients knows that your results actually don't apply to them. So it's very important to have a target population and then have sampling through that. Then we spoke about inclusion and exclusion criteria, how inclusion criteria says if a patient is sitting in front of you, how they should be included, whether they should be included or not. And then once they've included, do they meet certain characteristics which help you exclude them from your study, right? Again, how you're going to develop these inclusion and exclusion criteria, you define your population narrowly. I gave the example of a study done in Latin America about COPD and how whether patients were actually using their MDI pumps. The inclusion criteria of that study was adults over 40, diagnosis of COPD for at least 1 year, at least one spirometry in the last year with FEV1, FVC less than 0.7, and current or former smokers. And so exactly, so you have to have technical as well as non-technical inclusion and exclusion criteria, right? Then we spoke about the prerequisites for a study. We spoke about informed consent and the set of questions that every informed consent document should have. You should have this ready because you are definitely then going to move on to the next step, which is ethics committee approval. After your whole research protocol is set, you have to move forward with ethics committee approval, right? Then once you get that approval, you're going to visit a statistician. Again, so ethics committee approval, some people were questioning whether or not you need ethics committee approval if it's just a survey or if you're not actually, even doing a study on any person that's in front of you. Ethics committee approval is required for any paper that you submit to a journal. Now, what happens in cases where you don't actually need this sort of approval because you are not dealing with human subjects or animal subjects, etc. You submit your findings to the ethics committee, and they will in turn give you a letter saying no approval required for this study. Okay, so there is no ethical questions that are raised by the study, and therefore no approval is required from the study, and therefore you don't need that approval. However, you still need to submit your findings to the ethics committee, and when you're submitting to your journal, they will ask you for a statement saying it has received ethics committee approval, and you will say yes, the ethics committee has said so and so, and then you can attach your certificate along with it if they ask for it, right? Then you have to visit a statistician to determine your sample size, and frame your questions in such a way that you get objective answers, so that you can get even more data from your study, and you're not stuck with the answer that you've already gotten, so that your study has the most impact, right? Then how to assess a journal for reading. This is what Dr. Parag Tumne touched upon. It's basically, so journals can be seen by two people, right? They can be either be seen by people who are reading the journal, and for a person who's writing a paper and wants to submit it in that particular journal, right? So when you're reading different journals, what the things that you need to see are whether it's for a specific reader base. Means that, is this journal limited to just hepatology, or is this limited to, say, the spine, or is it limited to orthopedics, or just joints, or just cardiac, or just renal, etc. So every journal has a specific uh, uh, target audience that they themselves are catering to. So if you meet those requirements, that if you are interested in hepatology and stuff, then you go and subscribe to that journal. Then if it's international or region specific, depending on where you live, we hear a lot about ethnicity and genetics differing in different populations in the world, and therefore you need to determine whether it should, or the journal that you are reading should be just based in India or just Asia or internationally. So that again is a personal preference, depending on where you're based. So open access and paid viewership. So a lot of people had confusion about open access and what's paid and stuff. Okay, so open access is basically, like I had said earlier, it's open for the world to access. But what happens in open access is that when the author is submitting a paper to the open access journal, they have to pay usually a hefty fine, which ranges from $2,000 to $3,000 to submit their art, not to submit, but after their article is accepted, to publish their article in that journal, they need to pay around $2,000 to $3,000. But however, if it's not an open access journal, if it's a paid viewership journal, which means that if you go to the journal website and you see, you are trying to see a paper, the full text of a paper, they will tell you, okay, so please pay $30, then you can see the full text of the paper, right? So what happens there is that the author actually does not end up paying a lot of money for submission or publication in the journal, but instead that money is taken from the viewers. So this is the sort of the good and the bad with open access. And that's what basically open access means, okay? Now, impact factor and altmetric score. So impact factor basically refers to how reliable a journal is. Impact factor is directly related to the number of citations that the article in that journal gets. It basically means how many other articles are referring to this article when they're making their paper, right? So impact factor essentially means the authenticity of a journal. Now you all ask, what's the good impact factor, right? So impact factor can range anywhere from 0.001 to even 43, right? Which is NEJM's impact factor. So a decent enough impact factor, I think, for our our student base is somewhere ranging from 1 to 2. If you have a journal with 1 to 2, then you can definitely rely on that journal for any of your scientific needs and whatnot, right? Altmetric score is basically, so impact factor and altmetric score, the difference is that impact factor only assesses the number of times an article has been cited or quoted in another article on the journal, on basically the literature databases, right? But the altmetric score basically assesses how many times an article has been mentioned in Twitter, Facebook, Instagram, etc. So it not only gives you how if so altmetric score also includes how many times it's been published in how many times it's been quoted in other journals as well. So the difference between altmetric score and impact factor is that altmetric score actually assesses whether that paper is being read by a lot of people on non-scientific websites, right? And impact factor only assesses the other scientific journals or articles that are quoting this paper, right? Everyone good with the difference between impact factor and altmetric score and open access and stuff now?
Yes, sir. I guess.
Right. Right. Okay. So let's move on to, again, just discussing what Dr. Parag touched upon yesterday. This is the sample journal website of one of the best journals for surgery, right? And it says the impact factor right here is 0.7492, right? Sorry, 7.492. So what this basically means is that suppose you take any article in this journal, okay? It's basically been quoted by some other article in the whole literature database 7.49 times on average, okay? You don't need to understand essentially how that whole impact factor comes about, but it's basically a indication of the reliability of that particular journal, okay? Minimum amount of money required to publish in journal in India is 0, okay? There'll be some journals that publish for free, so you don't need to worry too much about that, okay? Okay, so then let's speak about examples of what happens on an article page, okay? So like Dr. Dhumne had mentioned yesterday, there are certain things that you'll see on an article page. This particular thing is your, okay, that's a horrible drawing. Let me just redo that. This particular thing is your author name. Et al basically means and all. Okay, so you can just think about it as and all. So Samshtir and all. Basically, Nietzsche gives you a list of the different authors that were involved in making this article. BMC Medicine is the name of the journal that's involved. 2017, the publication year. BOI is basically an electronic identifier. Okay, so every journal article, it's a unique electronic identifier. So basically, that particular the numbers that you see after DOI are linked to this article only. So even if you go on your Safari, if you go on Google Chrome, and you type these numbers on it in the exact format, they'll link you to this article. So most good journals have this is called a digital object identifier attached to each article, and each article has a separate one. So that is basically a unique number or code given to each article. And this cannot be common between two articles on any journal. So suppose this, you think that, okay, BMC Medicine has this DOI for this article. It cannot be possible that JBJS or BMJ has the same DOI for another article. No, this is basically journals register themselves on an online registry, and each article in the world is issued a unique DOI, right? So again, this is this is the type of article that's present here. Again, it says research article. So like we had discussed earlier, research article, review article, letters to editor, case reports, etc. So you can find out the level of evidence that this this particular article is providing. This will be the name of all the authors here, right? And star usually marks corresponding author. So corresponding author is basically a person who will answer any and all questions that relate to this article. So that does not mean that he alone is responsible for what's published. Okay, every author is equally responsible for what's published in that article. Okay, so even if you get offers to become authors in other people's articles, make sure you go through them. Make sure there's not some false data or anything involved in those articles, because if there is, then your name also will be dragged through the mud. You cannot claim that, oh, I'm only fifth author. No, every author has to agree with and sign a statement saying that they agree with what's been published, and they'll be responsible in the end about what's published. Okay. Everyone good so far? Right.
Yes, sir.
Okay, let's move on. Sorry, let me just clear these up. What's happening? Okay. Okay. So again, this is the abbreviations. So every journal article, even if the abbreviation is DNA, okay, you have to write the abbreviation at the end of your article, or even we'll talk about how to write your article in a bit. But these are basically all the abbreviations listed in that particular article. So funding versus conflict of interest, right? We discussed this in brief yesterday. So funding basically means anyone who's funded it, okay, whether it's a charitable organization, whether it's your own college. If there was any money involved, okay, if you yourself are funding it, you need to you can say no funding was received for this project, okay. But if anyone is funding it, then you should declare it in funding. Now, conflict of interest, okay. Suppose you are being funded by the Bill and Melinda Gates Foundation, okay, which is a charitable organization, okay, but your drug is basically it says Gilead. Okay, Gilead is the company that's released remdesivir and was used for COVID, right? So, but if you're studying Gilead through funding of Bill and Melinda Gates Foundation, you don't have a conflict of interest right then and there, okay? Because there is no association between Bill and Melinda Gates or yourself or Gilead, right? A conflict of interest arises when you yourself can gain from what is being shown in the article or what is being studied in the article. Okay, so if I'm studying remdesivir and I am a shareholder in Gilead, and I'm getting, suppose I have done previous studies for them, or I've given them a drug that I have discovered, and they are paying me money, or they are paying me royalty for what I have done for the services I'm getting, then that comes under conflict of interest, right? So funding source and conflict of interest are two separate things. Okay. Author details, here you'll find each and every author. So what someone's suggesting was, so how do I contact people, who are in research, and how do I, approach them? So one thing I would say is, start volunteering by, seeing some papers that you really like, seeing the author, corresponding author, who it is, and then moving on to asking them, sir, I am a medical student from India. If there's anything, any multi-centric study or something that you want to do in India, please do let me know. I'd be more than happy to assist you, or whatever, something like that, something along those lines. And maybe you ask 100 people, at least 2 or 3 will say, okay, I have this study I'm thinking about, maybe I can involve you, right? So this is how I've approached doctors. This is how you should approach doctors, right? Components of an article. We're going to go through them today because we're going to talk about how to write your article, right? But this is just a title. Again, you all obviously know what title is, describes the contents. Authors ensures recognition for writer. Abstract is basically a short summation of your whole article. So if your article is 2,000, 3,000 words, usually the limits for abstract range from 150 words to 300 words, right? So in 300 words, you have to say what you did, why you did what you did, how you did it, what you found out, and what are your conclusions, right? Introduction is explain the problem. Methods is how exactly you did what you did, right? Every instrument you use, everything that you did. Results is what of what you found out essentially. Discussion is basically you are placing your findings in the context of findings that were found before. So suppose today, if I find that I find a disease that is showing a new presentation, right? So it's not like I can't, there'll be no discussion that iska kuch previously kuch tha hi nahi, matlab, there is nothing, no other literature associated. No, I'll quote other studies that say, okay, no, this is the presentation, this is the presentation. I'm sure somewhere or the other there'll be some article saying, okay, no, I also have found this presentation. So you can quote that article, right? So it's not like if you're discovering something new, there'll be no discussion. No, that's not true. So we'll discuss about this more as we move on to writing our articles. Acknowledgements, like I said, that if someone has really helped you with your article, but you have reached your author limit, or you have reached the you don't want to include them as authors because you don't think they have done enough work for authors, you can include them in acknowledgement section. It can be an organization. Suppose I'm doing a study in Nair, I can thank Nair Hospital in acknowledgement, saying thank you for allowing me to do this work, or whoever it is. If you have a guide, if you have a mentor, you can thank them in acknowledgements, right? References again are basically those articles that you are citing in your discussion, in your introduction, saying, okay, this was found in this article. So that article becomes a references. Now there are different styles of references, which you can probably just look for online. There's something called EndNote, which makes your referencing really easy. So then we spoke about peer review, right? And a lot of people were confused with what peer review is and how we can go about peer review. So peer review is basically a process that's being followed by most, like some of the best journals, and it's usually given the highest sort of um, acceptance that, okay, if your article is peer reviewed, then okay, you're good. Like it's a really good article and it deserves our attention, right? So the overview of the peer review process, I know this table kind of looks confusing, but basically what happens is, if once you have your paper, right? Once you have your paper and you are basically ready to publish it, you've submitted your paper to the journal, right? What they're going to do is they're going to give it to an editor who is basically employed by the journal. That editor will then see your article, and each journal has their own what do you say, a list of recommendations that every article needs to follow. So what the editor will first do is he'll see your article, see the list of recommendations that need to be followed, and then he will see whether those two match, right? And if they do, then, and if he thinks that your article has merit on a first cursory glance, and if he thinks that, okay, I should forward this to other reviewers. So now reviewers will be those people who are experts in their field. So if your article is about public health, then they'll be PSM experts. If your article is about spine surgery, then there'll be neurosurgeons or orthopedic surgeons who are experts in spine surgery, right? And those people would really would be employed, again, not employed, but given these articles by the journal. So you don't need to worry too much about that. So once they give your article to these experts, then those experts can do one or two things. They will either accept your article, okay, in this form, which is very, very, very rare. They had always, or they will give you some recommendations on the article, or actually even a third one, they will reject your article, right? So even without, so again, if they accept it, awesome. Now either they say there are some reviews that you need to do, or they reject it, right? If they say there are some reviews need to do, that's a good sign. Although it does not mean that if you change anything in your article according to the recommendation, that will definitely be published. That's not the case. Okay. So if they ask you to change it and submit it again. But if they reject it, don't submit it to the same journal again. Submit it to another journal. Okay. Because they don't accept repeat entries for journals. Journals don't accept repeat entries for articles, right? So now the question of, although I discussed it earlier, the question was, can I submit to more than one journal because it takes too much time? Like I had said, no, you can't do that, because a lot of editors know each other. And if they find out you've submitted to more than one journal, it becomes a copyright issue. It becomes an issue of your reputation. So instead of that, just have some patience, because no one's going to kill you if you submit your article next year instead of this week. Okay. And what happens is, when you're in a rush, you just tend to not review the changes that the reviewers have mentioned properly. You tend to rush through your article even while writing it normally, and then just tend to submit it with half the details incomplete. And if most of your details are incomplete, even before seeing the article, the editor can directly reject it. Okay. So it's not necessary that he'll say, okay, sir, wow, you have such a good article, like, let's change a few things and we publish it. That won't be the case. If you're not adhered to the journal guidelines, he'll directly reject it. Okay. So that was peer review. And then we spoke about indexing and what indexing is. We spoke about PubMed, we spoke about Google Scholar, Embase. So I want to touch on a little bit, because I think I left it halfway yesterday, was that indexing is basically considered as a library, right? And that's what these are. These are online libraries. And a library will have specific books, right? Your college library will have Harrison, but it may not have some Indian Aman Mehta medical book, right? But the difference between our college library and PubMed and Cochrane and Embase is that they want to filter out the journals according to their repute and according to the quality of studies that they publish, right? So there are some good indexing websites, there are some not so good indexing websites, right? So if a good indexing website is PubMed, Cochrane, Embase, where you see your journal information and you see where it's indexed, right? And if they are really showing off about Google Scholar Index, or if they're really showing off about what's that called? I forget what it's called, but if they're really showing off about the Google Scholar indexing, then please do not either read or even read that journal, or submit your articles to that journal. Okay, because the really good journals that you should rely on are usually indexed in PubMed, Cochrane, Embase, and so on. But as you can see in the lower part, there are so many indexing websites based on you know just different companies that are really doing this and trying to profit from it. But yeah, so just make sure that you rely on good journals and just see where your journal is indexed before publishing it, because there can be some international journal of health and statistics and it sounds pretty cool, but you'll realize that it's actually not indexed anywhere, and therefore your data will not be published. Because I'll tell you why indexing in PubMed is good. Because as a student researcher, even today, if you want to search for some article, right, you're going to go to PubMed and then you're going to see those articles, correct? You're not going to go to, say, Sightseer, I don't even know what that is, or site-based search or Scimago or anything like that. And then, like, Scimago is a good one. But you're not going to Sightseer or something like that and then see where your article, search for articles there, right? So that's why if you're indexed in PubMed, the number of people that will see your article is much more. And trust me, like, instead of having 10 articles also, if your article is cited even once, right, that's a great thing. That's bigger than having, if you have one article that's cited 10 times, is bigger than having 10 articles that are not cited anytime, right? Because, and people know this, like we as medical students may think that, nahi, hame to bas article number, I have 10 papers, I have 15 papers, I have 17 papers, I have 20 papers. But that's actually not true, because true researchers know that it matters how many times your article is cited, where it's published, whether that publishing journal is indexed in a good place or not. Right. So just make sure you have tried and tested these before you move on. So now finding journals as per your interest. A lot of people had questions. So I'm interested in hepatology. I'm interested in, say diabetes treatment or renal or something. So again, you go to your PubMed website. On the bottom left, you see this. It says journals, right? Once you click on it and you type your field of interest, you type hepatology, you type renal, whatever it is. Suppose I type hepatology, I get 251 journals that either are indexed in PubMed right now or were indexed at one point in time. They're not indexed anymore either because they didn't adhere to the qualities or guidelines of PubMed anymore, or they just stopped publishing, right? So you see all these journals and you can definitely just go on these journal websites, see what articles they're doing, right? So in this way, you can find out the journals that are there on PubMed through the PubMed's own NLM catalog, right? Instead of searching on Google and then thinking, oh, is this reliable or not? So this is a way to find your journals, okay? And once you, suppose I click on therapeutic advances in gastrointestinal endoscopy and stuff, and then suppose I open that, and this is the information that it'll give me. And the most important is it'll give you a link, directing you to the journal website, so you don't have to go to Google again and then search for it. It'll give you the direct link to the journal website, and it'll also give you its current indexing status, which means that now if you publish your article in that journal, you will not be indexed in PubMed. All right. So just make sure you have these two things settled down before you choose a journal either to read or to publish in, right? Okay, just making sure you guys could hear me. So finding out if a journal is predatory, right? You get, as Dr. Dhumne said yesterday, you'll get a lot of people messaging you saying, hey, we're this European Journal of Health Sciences or International Journal of Medical Students or something like that, saying, we're really in need of articles. We want you to publish in our journal. Please send ASAP for publishing below within this 1 month and whatnot. But trust me, those are predatory journals, which means that if you see where they are indexed, either they lie about where they're indexed, okay? And you can easily find out through your PubMed journal search whether or not they're indexed there, okay? Or they will not be indexed anywhere. I mean, most of the times it's that they are not indexed anywhere, okay? So there are a few 13 steps that Sir had mentioned to find out if a journal is predatory. Is that if the scope of interest includes non-biomedical subjects, like if a person is ready to publish engineering, law, business, and medical along with it, then you know that there is something dicey going on, because journals are usually very focused in their interest groups. Okay, the website contains spelling, grammar errors, as you know that most fake websites are riddled with this. Homepage language targets authors saying publish now, free publication till 1st April or 1st June or whatever it is. Index Copernicus value again. So index Copernicus is kind of even worse than Google search in terms of reliability of journals that they publish on there. So if that is really being promoted, then don't be too reliant on that particular journal. Description of manuscript handling process is lacking. So each journal actually publishes exactly what they need from the author in the instructions for authors, and they tell you exactly what format your article should be, and whether your figures can be included in the original article page, or you have a title page and whatnot. Then rapid publication is promised, of course, another red flag. Um, Article processing fee is very low. Like I said, most open access journals have article processing fee in the range of $2,000 to $3,000, or at least more than $1,000. So this is not a direct link. Okay, agar ye hai to ye fake journal. And no, that's not the case. But if it is low and they are promising, like, fast publication, they're really supporting the index Copernicus value and stuff, then you can, be on alert that, okay, this is a fake journal. And of course, the correct email address is not professional. If they have something at gmail.com or something at yahoo.com, most journals have it at their website.com. Like we have like at PubGeek.com and stuff, right? So that was a recap on what we discussed yesterday. Okay. We're gonna move on unless y'all have any further questions. Let me just check YouTube feed. And unless you guys have any further questions, or can we start what we were discussing today?
Hello.
Yeah.
Yes, sir. There is 3 major questions I can see in the comment section. One is, what is the minimum amount of money required to publish
I
our
think I already
journal
answered
in
that.
India?
That answer was zero. That answer was zero. Because it doesn't need, your journal doesn't need to be open access. And if it's not open access, then it'll basically be free if it's not open access, right?
Okay. Another question is, what if we are viewing an article for literature review and that has cited a page, so for that particular data, which study will be put in the reference? Like if a original study is a paid article and we are referring it for literature review, shall we cite it or not? The results.
So what if you're viewing an article for review and that has been cited a page, so for that particular data of study will be put in reference? Okay, I didn't completely understand this question, but basically I think I understand the spirit in which it was meant. So basically, if you have, say, one article saying, um, you know, um, like spine surgery was formulated by, or say scoliosis surgery was formulated by a kite, right? And if you just copy that sentence and you cite that article, the same article that it is citing, right? The issue then becomes that if that person has not really gone through that article and they have just written that sentence there, then you tend to further that chain of falsification. So each and every article that you're citing, I would recommend that you read it. Okay, you read that article, and then you move on to answering your questions and what. I mean, then you move on to like actually citing it, right?
There is another question. Can we get online ethics committee clearance certificate? If so, how?
So that depends. Honestly, that depends entirely on your ethics committee if they're ready to approve your applications online or not. That changes from city to city. That changes from even institution to institution. So that's not something really I can comment on. Yeah. So preprints, right? Preprints are a lot in the fashion right now. So preprint is basically a journal gets an article. Okay, they have just an editor go through it, see that it complies with the journal guidelines and the journal requirements. Okay, and if it does, this upload it to the preprint server, which is pending peer review verification. Okay.
Yes.
Okay. So now I think it's time to start today's session.
Yeah.
We're gonna start with how you can design your own. We're gonna start with how you can design your own questionnaire surveys. Can everyone see this on their Can you guys see it at SNO? Can you guys see my shared screen?
We
Hello.
can see it, sir.
All
Yes,
right,
sir,
okay.
we can see.
So we're going to start with how you can design questionnaire surveys, right? Because that's one of the most popular ways that medical students go about doing their research. So questionnaire surveys, what you need for a questionnaire survey, you need a sampling frame from which you can choose a representative sample. Again, a sampling frame is basically your target population that you're talking about. And a representative sample is basically the kind of people that you need to be in your study so that you can talk about the target audience, okay, the target population. A survey instrument that has been vetted, an invitation to encourage participation, whether it's a Facebook link, whether it's an Instagram link, whatever, or means of dissemination, mail, email, telephone, whatever you want to rely on. Method of following up in non-respondents, a system for creating and managing a database of survey responses, and a plan and method for analyzing your results. Right. So a lot of these things, a sampling frame with a representative population, your statistician will help you with. A plan and method for analyzing results, your statistician will help you with. A survey instrument that has been vetted, again, your statistician will help you with, right? And most colleges have their own statistician within the PSM department. I have one at Nair as well. And we at PubGeek are working to give you access to a statistician soon. So you guys can just email them or something, and they'll help you out with your study and whatnot. That's what we're working on. No promises on when it's actually going to come to pass, but that's what we're working on. Okay, so let's move on to A and D of questionnaires, advantages and disadvantages, right? You can collect personal and or risk factor data not typically contained in hospital records. So see, there are two ways of basically going about things, right? One is either you are studying patients, and the most common way of studying patients is you go to the hospital. Hospitals usually have records of their patients spanning 7 years. Okay, so you go to the hospital, you see what stuff that patient came in with, and what was at least written down by the doctor. Okay, and then you say, okay, that patient healed, his fracture healed within 2 weeks, and that's a great response. And on average, the fracture healed within 3 weeks. Yeah. But suppose that doctor there did not ask about a particular risk factor that you're really looking for. Now, fracture is quite simple, but if you're talking about, say, ischemic heart disease or something along those lines, then becomes the risk factors becomes quite complex, and you may not find it in those records, right? And that's why you're starting a questionnaire or survey, so you're getting first-hand information from the patient, right? Disadvantages is each survey response need to be validated, and it becomes quite burdensome and costly. So again, let's move on, and then you will understand what the basic difference is. So okay, so a lot of people don't understand the difference between a survey and a questionnaire, right? So a questionnaire is a item or a list of questions that has been vetted either by experts or by, just give me a second, I'm getting a call from the hospital. Yeah. Oops. Yeah, sorry, you may have to cut today's session short, but not quite yet. Okay, so the difference between questionnaires and surveys is that questionnaires actually don't actually need to be vetted by either a pilot study that you've done, or it needs to be reviewed by certain experts in that field. It could be any senior consultant in that field saying that, okay, this each and every question is leading to something good information that can be procured from this survey, right? And that's the basic difference between question and survey. And survey doesn't need to be vetted at all. You can just take a survey and just publish it. But take a survey and just give it to people, and that's how you start your survey assessment. But that's the difference between questionnaire and survey. Okay, if if you have not vetted it, and if in your research paper you say, hey, this is a questionnaire, then you might be in trouble. Some people may still, let you go even if you're presenting a paper or a poster. But understand the basic difference between the two. It'll help you in the future. And if anyone else is not doing that, then you also know to point it out, right? You can ask that question. Hey, it's a questionnaire, right? So, did you finish a pilot study, or did you have which experts vetted it and stuff? Um, Anyway, so again, you have something called interviews that you can do. They can either be through phone, through text based, or they can be through video, or even in person, right? What you need for them is a method to identify, recruit people. Again, identify your target population and then recruit it. It's not that jo bhi aaya chalo usko study mein leta. No, you have to identify your target population, take a sample of that target population, and then you want to interview them. Um, an interview protocol with primarily exclusively open-ended questions. So open-ended questions are usually for qualitative studies, such as in psychiatry or psychology. But you need an interview protocol. So what an interview protocol means is that you need to have the interviewer say, at least stay on a particular script that you have prepared, right? Because what happens is, like I had mentioned on the first day, I think, is that if an interviewer is very enthusiastic, say, hey, how are you feeling, Miss Asha, today? Wow, with so much progress and whatever. And if the other says, kya ho gaya aapka aaj? What's happening? You okay? So then the enthusiasm of the patient may also change, giving you results that may lead to some, problems in your results, right? Will give you some skewed results or something like that. So make sure that you've prepared, even if you're just calling people and asking them about A or B or C, make sure you prepared a script so that you don't deviate from it, so that, you can mention that there's a script prepared in your paper that you are, making, and you haven't deviated from it and stuff. Then you need skilled interviewers, usually high level studies done by hospitals and stuff. You have skilled interviewers that are doing this, with different language support. And so that, you're not just excluding someone just because they don't speak Hindi or they don't speak English or, Malayalam or whatever it is. So a way to record the interviews and either summarize or transcribe them. So either you need a sheet that the interviewer is, checking off boxes objectively, or you need to record it and then, you need to sit through the recording and then do it yourself if the interviewer is not skilled or he doesn't know what exactly to type, put in the questionnaire or survey that you've given him, right? And a method to analyze the results of all your interviews. Again, this is mostly for psychology, where they have qualitative data analysis and they have software programs for that as well. Then you have to have a staff who have skills in qualitative data analysis, because you need to have statistician on board usually, because usually what happens is, so there was actually this interesting, I don't know who, I'm not going to mention who did it, but there's this interesting study that someone did in one of the paper presentations that I've gone to. And the study was in a person who suffered from a stroke, right? A cerebral, basically, and basically they've blocked their arteries to the brain, right? For first year students who may not know, how is their ECG pattern changing, right? How ECG pattern can be, used to identify whether a person has a stroke or not. And she actually, he or she actually published, I mean, not published, but actually gave a presentation on this. Meanwhile, in the audience, everyone was kind of dumbstruck. They thought either that the paper is really, really good or it's really, really bad, right? But the judges thought that it was really, really bad because there was no association between an ECG and something that's happening in the brain, right? And they really went to town on her, and it was not a pretty sight. But irrespective, just like the first thing that I would think after seeing that presentation, okay, she's not consulted a neurosurgeon or a neurologist, or she's not consulting a cardiologist, right? Because either of those people would tell her, hey, this study that you're, spending so much of your hard-earned effort and everything on, you will not get results that you are really looking for, and your time is going to be wasted. But anyways, just know that this is just a silly example that I I was interested in telling you. So again, hospital care records. So I said the other way of performing research is you go to a hospital. They usually have these records with you, records with them of different patients, and then they'll see. Then you can see whether what you're looking for is really there in those records or not. Why this becomes disadvantageous is because those records may not have, say, suppose you're studying about D-dimer and maybe the chances of getting pulmonary embolism, and some cases may not have D-dimer written in those records, right? So then that becomes disadvantageous, where you have to, exclude those patients from your study, and it kind of skews your results a little bit. But usually they contain a lot of data and help you with clinical information. But again, if you have scores, like in orthopedics, is something that I'm interested in. They have a lot of scores. They have a knee score, they have a hip score, they have a spine score, etc. So those scores, you can't go back to the patient and say, "Acha, aapko operation ke pehle kaisa feel ho raha tha?" Right? And usually those scores are not included in these hospital records, and that becomes a disadvantage for some people. Some people, like even if there's a hope score or whatever score, even in medicine, there are so many scores that um, you need to assess when you're writing a paper, and if usually they're not present in these articles, in these healthcare records, and therefore that becomes disadvantageous. So it's always good to have a prospective study, prospective and retrospective. Like prospective means that you're taking patients after today. Retrospective means that patients have been already treated. You are seeing patients that have already been treated. Right? That's basically the difference between prospective and retrospective. Okay. So there are some handy tools for gathering quantitative data. I'm sure you're all aware of Google Forms, but I just want to mention the other two. And for those of you who are not aware of Google Forms, it's a free basic form. You can set up validation rules, which means that um, if suppose I'm asking them their age, and if someone types AB, then Google will pick up that it's not a number, and therefore not allow them to fill that particular thing in their age. And you can set up, okay, it should be a 2-digit number or stuff like that. And there's no logical conditional logic or branching, which means that if I say, okay, did you have breathlessness yesterday, and if I say yes, I cannot pop up 5 questions if someone says yes, and 5 different questions someone says no. That's called conditional logic or branching. That's not something I can do with Google Forms. And if you have really long forms, and if a person is trying to answer these questions, and if that person sees, okay, it just goes on for pages and pages, he may just not answer it. But if you have conditional logic, the forms feel small, and if they open up a question and then they have to answer, you get your response rate will be substantially higher with this sort of thing. And he has something called SurveyMonkey, right? It's a freemium, which means that there is a free version to it, there is a paid version to it. Free version is usually only 100 responses are allowed. The paid version is something like I think it's around $15, which translates to around 1,000 rupees, which is not a big deal if you have to spend it on your research study. It allows a variety of conditional logic and branching. So it allows you to say, hey, do you feel breathlessness today? Yes. Then what were you exercising, or this thing? No. Then etc. Did you sleep well, or whatever it is, whatever questions you want to frame. I can't think of too many on the top of my head. But it allows you that conditional logic. So your forms, although for you to make, become more complex, but it becomes much more easy for a person to answer them. Because otherwise you're saying, if yes, in the next question, if say you feel breathlessness, he says yes, and you say, if yes, then please, then were you exercising? So that becomes really irritating and frankly annoying for a person to answer those questions. And he's just trying to help you out. He's not getting any financial remuneration or anything for it. It has better collection options as well. You can take surveys on Facebook Messenger and mobile apps within the app right there. And then you can collect responses offline and then upload it. So people who are doing studies in faraway places where they themselves are holding a tab, and they don't have access to internet. So Google Forms needs internet and stuff, but this gives you access to offline. So you just you yourself are typing it. If you're giving it to other people when there's no internet, you type it in and you submit it, and then once you connect to the internet, automatically uploads, and then you can use it for your Excel sheet and whatnot. So it's a little more convenient than SurveyMonkey. It is paid for for some features, right? So you can, depending on what sort of study you're doing, the complexity of the study. I'm just giving you examples of different software that are actually out there that you can use, you may not know about. Airtable, again, is something that I use every day. It's geared towards collecting data for non-survey related studies. So if you're using the hospital records example that I gave you, there are going to be a lot of data that you just need to capture, right? So Airtable is sort of like an Excel sheet. It's sort of like Google Form essentially, right? But it gives you so many more options, so many more customizable tools. It is free in the start, so you can definitely use it instead of Google Forms. It's a little more complex than Google Forms to use, but it gives you so many more customizable options. and it allows you creation of multiple fields. And it's not, I wouldn't call it a survey tool, just because there are easier survey tools like SurveyMonkey and Google Forms available, but you can definitely use it for the same. But it's usually that if you're using hospital record data, then you should definitely use it, right? Okay. Right. So let's move on to how should I collect data? Okay, formulating your own data management plan, right? So the types of errors in studies are, it can go either three ways, okay? Either you're producing bad data, okay, which okay, so let's just start. So there are three basic types of error, okay? These errors that are in the study planning stage that result in data collected that is of no use and will not play a role in answering our research questions and objectives. Okay, that's bad data, right? And that's why there is data management, so that in the study protocol, so that it is designed to be, error proof, essentially. Okay. So suppose there is some sort of data that we're collecting that is actually wrong. Okay. Consider you are using a weighing scale, okay, that is off, that is not working, that's 50 years old and is really not working. So if you're weighing everyone on that weighing scale, you're producing bad data, which means that it's not reliable from the get-go. Okay. Or there could be errors in data management, which mean that suppose you have said, okay, you've used a proper scale and you have said, okay, this lady's weight is 50. Okay. But the person who is actually filling that data, suppose you're filling it in an offline form and then you're uploading it through Google Forms or SurveyMonkey or Airtable, etc. And suppose the person who's uploading that data says accidentally puts 40, right? Then that again becomes an issue because again, you have data that is, skewing your results either way. And then there are errors of statistical analysis, because sometimes what happens is you think, okay, hey, I don't need a statistician, it's difficult to find a statistician, it'll take me time, he'll take 5 days to give me results and stuff. Instead, I'll just do it, or t-test hi to karna hai kya usme. So sometimes the statistics, trust me, is one of the most complicated fields of research, and thank God that you don't have to do it, because there are statisticians available. So there is something called parametric tests and non-parametric tests, and if your data has to meet certain guidelines in order to use the t-test, and if it doesn't meet, you can use non-parametric tests and stuff. So you should make sure that you're using your statistics properly, and your errors that way are limited in both producing bad data, data management, and in statistical analysis, right? So again, like one example, suppose I'm talking about people consuming food, and I want to see how many calories it takes to gain suppose 1 kg in a 60 kg woman, right? um, so I use self-reported energy intake, which is basically I ask them aapne aaj kya khaya, and they'll say aaj roti khai, dal khaya, rice khaya, whatever, right? And sometimes, most of the times, they won't be able to tell you exactly what they ate, and that will give you bad data, right? That will give you data that you can't really rely on, that you can't base statistics on, you can't base your conclusions on, right? So usually this is called a recall bias, and usually it results in producing bad data. And there are certain confounding effects. So confounders are basically, suppose I'm talking about a person's alcohol intake and a person suffering from lung cancer. If I'm trying to study whether alcohol intake is associated with lung cancer, right? But I should also remember that people with high alcohol intake are usually tend to be smokers, right? So is alcohol intake associated with lung cancer, or is smoking associated with lung cancer in this case? So here, smoking becomes a confounding factor where it's affecting your results because it's related to your results as well as what you are trying to ascertain. So it's a little complex. We go through it in the statistics module tomorrow. But yeah, those are the main ways that you can actually, produce bad data. Okay. So again, bad data is the worst form of error because it's one in which you can never come back from it. You're not going to go approach 800, 900 people again saying, so please fill up this data. This question I asked wrong, or this scale that I used was wrong. So please give me your weight again. There's no justifiable conclusions that can be made. You can't say, okay, ठीक है, चलो सबका ही weight 5 kilo कम होगा पुरानी scale में. That can't be the case, right? Then you have errors of data management, in which, again, like I said, you have errors in initial documents copied to the database, interpretation of data in initial document. Like if a person is writing 50, but if the person who's putting that data online is saying, no, it's 40, then again, you're messing. It's a very simple form of an error. And you say, nahi, ye to kaise hoga? But when as the complexity of your research idea increases, the chances of this happening are much, much more. Okay. And therefore, you need to establish certain protocols and certain checklists with each person that's handling that data to make sure that no one's messing with it, and you're getting accurate. You're getting the fruit of your results essentially. So again, you prevent errors of data management. You establish checklists, like I said. If your values are missing for one individual, it's better to avoid including that individual. If you think ki nahi ye bande mein kuch to lafda hai, so then you completely avoid including that person from your analysis. Okay. And the third is that you should keep your data with you, because eventually what happens is that even if you publish your data, it's all good. You think, okay, wow, mera study khatam, chalo. But people can ask you for the original data from your study, whenever or wherever they feel that they're raising some questions on your study. You can just simply provide the data with, hey, this is what I based my study on, and then no one can able to question you. So what I usually do is I usually save it on 3 places. I save it on a USB, I save it on my laptop, and I save it on the cloud, so that it's just safe, and I'm not going to lose that data for every study that I do. So there are some errors of statistical analysis. Like I said, some tests are parametric, some tests are non-parametric, and you need to know which ones are which. And the best way to do this is to consult a statistician, and how this will help you. Consult a statistician not just after your study, but also before your study, so that they know exactly what. So that you know exactly what is happening, and they know exactly what sort of study you're going for, what sort of test they're going to use, how to modify your data collection according to the test that they will use for this particular study, right? So you need to establish a data plan, which may sound complex, and this is the essential cycle to establish the data plan, which is you plan how you're going to collect your data. Okay, collect and organize this new data, assure data quality by establishing checklists, and then describe the data, use the data, and preserve the data. Like I said, it's very important to preserve your data, because anyone at any time can ask you, hey, I saw your study and I don't believe you, and I want raw data for it. So rule 1, a good first step is to list the various types of data that you expect to collect or create. So I'm just giving you a rule guide on basically how you're going to make your life easier. Like I'm sort of giving you a checklist on what to do when you're starting off with your study, which is maybe new or old or whatever it is. So good first step is to list the various types of data that you expect to collect or create. This may include text, spreadsheets, software and algorithms, models, images, movies, audio files, patient records, whatever it is. Just make sure you've listed it listed somewhere about the data to be collected. Okay, just give me 1 more second. I'm getting a call again. Hello. Okay, guys, so we might have to cut short our presentation today. I'm really sorry about it. But there's a patient that needs to be transferred, and I need to go there in a bit. So I'll just finish this talk, and then we can continue. Maybe tomorrow we can start an hour early, or we can go on late. Right. So again, identify data to be collected. is you need to identify what sort of data you're collecting, whether it's text, spreadsheets, software, and algorithms, models, images, how you're gonna uh, sort out that data once you get it, whether it's making folders on your laptop or using a software like Airtable or whatever. Just make sure that you have it. um, what sort of sources are you going to, are you directly going to observe this data? Are you going to have experiments? Are you going to have simulations? Are you going to have interviews that you're collecting, or you're going to compile data from other studies like in meta-analysis and whatnot? um, the volume of data, amount of data to be collected, so that if you're using, say, Google Drive, which usually has a 25 GB limit on free accounts, you may exceed that amount, and hey, like, what do I do now? So just make sure that a picture is roughly 2 to 3 MB. If you're collecting 1,000 patients, that's around 2,000 MB, right? So which is around a little less than 2 GB, right? So just make sure you have all this in your mind, so that later on you're not bothered with all these things. And the data file and formats, good choices are usually CSV and Excel, because that's what statisticians use to put your data into SPSS and then give you whatever analysis you need from it. So again, rule 2 is define how data will be managed. Whether you'll be using programs like Excel, who's going to be managing it, exactly. So who's going to be collecting it, how that person is going to transfer it to whoever's managing it, and how that managing person is going to put it online. Or even if you're doing all those things, say, okay, I'm going to collect it in these 2 days, then upload it, then again collect 2 days, then upload it. Whatever you want to do, just establish a plan, definitively. And if you have larger data volumes and usage constraints, you may require relational database management systems, which if you do, please contact me on contact us at PubGeek.co, and we'll definitely help you out with setting up MySQL databases and whatnot. In rule 3, describe how quality will be assured. Make sure that it may be necessary to follow some quality assurance and quality control guidelines, depending on the nature of the study and the research sponsorship. And there may be such requirements stipulated. If they do exist, they'll be stated in your research protocol. Regardless, it's a good practice in general to abide by some quality assurance and quality control measures that you plan to employ in your project. They may include training activities for all the people who are involved with your all the people who are involved in your research collection phase, and how to evaluate errors. Just give me 1 second again. Okay, guys, I have to rush. So we're gonna continue this tomorrow. All right. I'm really sorry that I had to do this, but tomorrow I'm off duty, so I'll be able to help you guys out with everything that you need. We'll give you the exact timeline of how we're going to do, how we're going to go about this tomorrow by tonight. So I just have to rush. There's actually a patient that needs to be transferred. Right? I'm so sorry about this.
Yes, sir. Not
But
an
I'll see you
issue.
guys
We
tomorrow.
understand.
Yeah.
Thank you for
Again,
taking
remember to
out
subscribe
time
to
from.
PubGeek. Remember to subscribe to SNO Chhattisgarh and PubGeek on Instagram. I'm going to see you guys tomorrow. I'm so sorry this had to end this way. I really try to fit it into my schedule, but I'll definitely see you tomorrow, and we finish everything that we need to talk about. All right. Thank you.
Yes, sir. Sure. Thank you so
Yeah.
much, sir.
Bye.